Hello Brain Charge TV family, welcome back to our channel. Today we are going to talk about one of the most important and intriguing aspects of medical science, surgery. Surgery is a medical specialty that uses operative techniques to investigate and treat various diseases and conditions. In this video, we will delve into the history of surgery, starting with its origins and tracing its evolution over time. Classical era of surgery. Surgery is a medical practice that has been around for centuries. In fact, it can be traced back to the earliest civilizations in human history. Let's take a look at how surgical techniques were developed in ancient civilizations, and how they have evolved over time. The ancient Egyptians were among the first to develop surgical techniques. They developed procedures to treat fractures, wounds, and tumors. One of the most fascinating practices developed by the ancient Egyptians was trepanation. Trepanation involved drilling a hole in the skull to relieve pressure or release evil spirits. This practice was often performed without any form of anesthesia or pain relief. Despite the risks and lack of advanced medical knowledge at the time, some patients survived these primitive surgeries. Similarly, the ancient Indian civilization also developed sophisticated surgical techniques, many of which are still in use today. One such technique was rhinoplasty, the art of reconstructing a nose. The procedure involved using a flap of skin from the forehead to create a new nose, and it was often performed on soldiers who had lost their noses in battle. Other surgical procedures developed in ancient India included cataract surgery, lithotomy, and hernia repair. The development of surgery was largely based on practical experience and the desire to relieve pain and suffering. However, surgical techniques in ancient times were not always successful, and many patients did not survive the surgeries. Today, surgical procedures are highly sophisticated, and they are performed using advanced medical technology, anesthesia, and infection control measures. Surgical procedures are now used to treat a wide range of conditions, from cosmetic surgery to life-saving procedures like heart transplant surgery. Thanks to the ancient civilizations of Egypt and India, we have come a long way in the field of surgery. The surgical practices developed in these civilizations laid the foundation for modern surgery, and their contributions to the field of medicine cannot be overstated. However, it wasn't until the ancient Greeks that surgery began to be viewed as a distinct medical specialty. The father of modern surgery is considered to be the Greek physician Hippocrates, who developed surgical techniques like suturing or stitching to close wounds. Over the centuries, surgery continued to evolve, and many notable physicians made significant contributions to the field. For example, in the Middle Ages, the Islamic physician al-Zahrawi developed a range of surgical instruments, including scalpels, forceps, and specula. During the Renaissance period, the famous Italian surgeon Ambroise Paré introduced many innovations in surgery, including ligature, a technique for tying off blood vessels to prevent bleeding during surgery. Modern era of surgery. In the modern era, surgery has continued to evolve, with advances in anesthesia, sterilization techniques, and minimally invasive surgical procedures. Today, surgery is an essential component of modern medicine, used to treat a wide range of conditions from cancer to heart disease. Modern surgical procedures are highly sophisticated, and they are performed using advanced medical technology and specialized surgical instruments. In addition, the development of anesthesia has made surgical procedures much more comfortable for patients. Another significant development in modern surgery is the use of sterilization techniques to prevent infections. Surgical instruments and equipment are sterilized to prevent the spread of bacteria and viruses, reducing the risk of complications. Minimally invasive surgical procedures are also a significant development in modern surgery. These procedures use small incisions, specialized instruments, and advanced imaging technology to treat conditions without the need for traditional open surgery. Thanks to these advancements in modern surgery, patients can recover more quickly and with less pain than ever before. Surgery is now a vital component of modern medicine, used to treat a wide range of conditions. And that's how surgery has continued to evolve in the modern era, with advances in anesthesia, sterilization techniques, and minimally invasive surgical procedures. So, in conclusion, surgery has come a long way from its primitive origins, and has evolved into a sophisticated and highly specialized field. We owe a debt of gratitude to the many physicians who have contributed to the development of surgery over the centuries. That's all for today's video. Thank you for watching, and please don't forget to like and subscribe to our channel for more informative content.